I think pharma and pharma marketing need to do two things. One, we need to get rid of the SOY, which is the shit of yesterday. We need to get rid of all those old practices, old ways of working to be really competitive in the future, in the new technology, in the new landscape. The second thing is we really need to put the patient at the center of everything we are going to do. We need to bring the marketers in front of the patients, in the clinics, in the HCP practices. They need to talk to the patients and understand what the patients are going through. That way they will be able to deliver better marketing.
We still need to move away from being so extremely focused on trying to get the HCP to talk to us and actually focus on the holistic view of the patient. So we want to talk to the patient and we want to engage with them, but we don't really get down to it. And then it becomes very much like just helping them take the medication and develop adherence programs for them.
What we want to focus on is content. I think content creation is truly something that marketeers need to spend more time on and thinking about with their agencies as well. But secondarily, it's more the marketing mix, right? So right now it seems like we're really focused on specific channels. Yet we still come back to the content in those channels. We don't understand what that looks like. And I don't want to use the buzzword today, but it's really what does that journey look like? And more importantly, how does that journey align to your overall brand objectives, goals, strategic initiatives, and then how are you measuring that?
We do need to move with patients, move with our customers, because otherwise Dr. Google will become Pharma Google as well, and we'll actually see that patients move away from the sound scientific advice that pharmaceutical companies provide.
I believe the fundamental biggest inequality is actually in information, and I think it is critical we get better at providing holistic, informative and really valuable information to all the stakeholders in the industry.
The most critical thing for pharma marketing to solve is the age-old aspect of bringing value. We've got a higher hurdle today to bring value, and we have new tools that we can use in terms of digital, of course, is the ultimate buzzword. Analytics is another buzzword, but we need to turn that into real solutions that warrant a price, a good price, and that's a massive challenge.
Yeah, I believe that pharma marketing needs to take one step further beyond understanding the customer journey towards actually further understanding that moment of truth where the customer, i.e. the patient and the doctor, where they interact. That moment is where they add value, it's where they should be adding value, and they need to find out exactly what their role is in that. Not just as an individual company, but also as an industry.
Pharma has to solve its own identity crisis. So it sits in its kind of ivory tower, agonizing and mulling over what they need to do, how they need to engage with people, and trying to put together frameworks and rules of engagement. Actually, on ground level, people, patients, we're just running around and getting on with it. So it would be really great if they could stop entangling themselves in their fear of meeting others. I like fear of missing out, but in pharma it's fear of missing others. Just come out, come meet with people and engage with them.